So welcome back. We're here with Dr. Diarmuid McCoy, Specialist Pain Medicine Physician, and on this webinar we're looking at pain-related interventions. So Dr. McCoy, could you share with us what we mean by pain-related interventions?
Well, it would always be an attractive option for a doctor to completely eliminate the pain from the patient presenting. That makes us look good, makes the patient very grateful. Interventions are therefore quite an attractive option if used appropriately. Some of these can be diagnostic. When you suspect a particular structure, joint or area, then applying local anaesthetic to that area might result in a decrease in pain, and therefore we can conclude that that particular target is the pain generator. This can then be followed up with such techniques as cryotherapy or thermal radiofrequency, etc. Other interventions might include steroid to decrease inflammation, along with the local anaesthetic, such as into the epidural space for radicular pain. This can also be applied to the nerve roots and then followed up with pulsed radiofrequency. In this case, it is not appropriate to be predicting the effect of pulsed radiofrequency by using a local anaesthetic block. These are all of the complicated decision-making trees that a specialist pain medicine physician is well placed to navigate. It is important that the decision to pursue an intervention is appropriate, with the appropriate patient, the appropriate pain presentation, the appropriate block at the appropriate time. And again, the specialist pain medicine physician is well placed to make that decision. It is not always the case, as we said when we were looking at x-rays and radiology, that the appearance on x-ray is determining where the pain is being generated. But a suspicion from clinical examination and the history, putting that together with a diagnostic intervention, may bring out a clear answer. Steroids can be used, local anaesthetic can be used, and then heat and cold lesions such as radiofrequency can also be used. This space is evolving very quickly. Pulsed radiofrequency in different types, percutaneous electrical nerve stimulation is also an intervention, a temporary intervention that can lead to long-term improvement. Other things that have been a little bit controversial, but some clarity is emerging, is the use of blood and plasma injections. We know that platelets contain nerve growth factors, things like calcitonin gene-related protein for the improvement and repair of tendons and soft tissues. And this can be achieved by using platelet-rich plasma, but there are a number of ways this can be achieved, and it is important that the appropriate way of preparing the sample for injection is used and then delivered to the site, usually under ultrasound guidance. Poking the pain-related interventions is extremely complex, and there has been lots of debate. There are, however, intervention societies in Europe and North America which are giving guidelines on when and how these should be applied. Similarly, the Faculty of Pain Medicine is providing a framework for training and credentialing of interventional physicians to take these techniques and apply them appropriately. So I think we should approach the future with increasing confidence and see that individuals who have gone through the program at the Faculty of Pain Medicine will have the requisite skills and knowledge to apply interventions to the appropriate patient at the appropriate time.
So Dr. McCoy, who should be undertaking pain-related interventions? What kind of specialist?
Well, as we opened these series of videos, the specialist pain medicine physician is a doctor who has specialist knowledge, qualifications and training, along with a fellowship in the management of pain. It does not specifically say what skills they have in any particular facet of that, but it is important for the public to know that they are approaching an individual with that qualification with the expectation that they will be able to provide some knowledge in the management of pain. If that individual has specific knowledge and skills in addition to their basic qualifications and interventions, then the patient can be confident that that person can intervene with needles, injections, or other types of therapy in the broad interventions for pain. This is not always confined to specialist pain medicine physicians. Those in musculoskeletal medicine, in neurology, in neurosurgery, often have acquired high levels of skill to deliver these interventions. It is now come to the stage where the Faculty of Pain Medicine will credential specialist pain medicine physicians with additional recognition of being able to undertake safely, scientifically, and appropriately the interventions associated with persistent pain.
Okay, thank you for that, and thank you for explaining the important role of pain-related interventions. For the next few video tutorials, we're going to be looking at the role that opioids and drugs have in the management of pain. So we do hope you'll come back and join us with the next video tutorial looking at opioids, the good, bad, and the ugly, and when they should be used. So thank you again, Dr. McCoy.
Thank you.